Have you ever wondered why, in a perfectly healthy kidney, stone-like things can slowly start to form? And as these little stones grow bigger and bigger inside the kidney, why do they cause such excruciating pain that people end up writhing, vomiting, and feeling like life is worse than death? Alright, now please grab your water cups, kettles, or bottles and listen as I explain it to you step by step. Every day, our bodies produce a lot of waste after our cells eat and drink, and this waste needs to be expelled through the kidneys, which act as a massive sewage treatment plant. Because whether it's essential nutrients or unwanted metabolic waste, they all have to travel through the bloodstream. So, when blood enters the kidneys can't just simply remove the water, they need to carefully sort through everything flowing inside before finally producing urine.
Small molecules let in, blocked out by toxin.
Useful. These are sent back into the bloodstream, and the rest is used to make urine. After these waste products are sorted out, they become concentrated and gather together, like a pool filled with various chemicals where all kinds of reactions can occur. Among them, substances like oxalates, urates, and calcium can come together to form compounds with low solubility, which then precipitate out. However, our urinary tract is very smooth, so a small amount of sediment can't stick to it at all and will quickly be flushed away with the urine. That's possible. But for certain reasons, like frequently not drinking enough water or eating too many foods high in oxalates, the concentration of these easily precipitated substances increases and becomes overly saturated. If the pH value of the urine changes a bit at this point, it can promote chemical reactions, causing a sudden increase in sediment. This makes it much more likely for these substances to stick to the kidneys, just like limescale clings to the inner wall of a kettle. When the first batch of debris barely manages to cling to the riverbank in the turbulent flow, we call it a crystal nucleus. Once a crystal nucleus forms, other sediments no longer have to struggle to reach the shore. They just need to latch onto these nuclei to settle down easily, thanks to the support of those who came before. As a result, the tiny core grows bigger and bigger, like a snowball rolling downhill, eventually forming a hard little stone. This is what we call a kidney stone. Some stones are quite small and can be persistently flushed away by urine, eventually being passed out when you urinate. But some stones are larger. After finally breaking loose, they find they can't pass through the narrow channel into the ureter, so they get stuck in the kidney and become kidney stones. You generally won't feel anything special during this process, but when these larger stones can't fall down and rattle around in the kidney, bumping into things, you may feel a dull pain in your lower back or upper abdomen. But for some people, their stones are particularly troublesome, not too big, not too small, just the right size to pass from the kidney into the ureter, but then they get stuck at a narrow spot in the middle of the ureter, becoming ureteral stones. At this point, the already narrow ureter, seeing that the crucial water pipe is blocked, will contract forcefully in an attempt to squeeze the stone down. This spasming process causes an intense pain so severe it can make you feel nauseous and vomit, giving you an experience comparable to torture. And some of these stones have sharp edges, so as they travel down, they can scratch the surrounding tissues, causing you to have blood in your urine.
I'm sorry.
Even if the stone somehow manages to pass through the ureter and reach the bladder, it can still end up blocking the urethra below, causing your urine flow to suddenly stop midway and resulting in pain. Formation of stones is not only related to an increase in metabolic waste in the urine, but also to factors such as taking certain medications, urinary tract infections, obstructions, and so on. In addition to the most common type, calcium oxalate stones, there are also calcium phosphate stones, struvite stones, uric acid stones, and cysteine stones. In daily life, to prevent the formation of kidney stones, what we need to do is try to reduce the concentration of substances that promote stone formation as much as possible. So you need to drink enough water every day. You should drink enough so that you can urinate more than 2 liters in 24 hours. This way, the raw materials for stones will dissolve obediently in the large volume of urine without having a chance to precipitate and form deposits. When I say replenish your fluids, I don't mean replenish your sugar. Drinking large amounts of sugary sodas can actually increase your risk of kidney stones. Coffee and tea, on the other hand, can be consumed in moderation because they have a diuretic effect. Moreover, components like tea polyphenols in tea can help inhibit the formation of kidney stones. However, tea also contains oxalates, which can increase the risk of calcium oxalate stones, so it should also be consumed in moderation. For those who already have kidney stones, after a doctor has made a preliminary assessment of the possible stone composition, dietary adjustments can be made accordingly to reduce the production of these stone-forming substances. For example, people with calcium oxalate stones should limit foods high in oxalate such as spinach, amaranth, strong tea, and nuts, while those with high uric acid should actively control their uric acid levels and so on. If necessary, certain medications can also be taken to further help expel these waste products and prevent their accumulation. For patients with calcium stones, it's also important to supplement with enough dietary calcium, because this calcium in the intestines can bind to oxalate, preventing it from being absorbed into the blood and urine, thereby reducing the risk of stone formation. Let me go. You really want to be peed out that badly? Well, that's still better than being pooped out, isn't it? But you should get this calcium from food, not blindly take calcium supplements, as that could actually increase the risk of kidney stones. In addition, patients with calcium stones also need to control their sodium intake because high sodium consumption inhibits calcium reabsorption, causing more calcium to be excreted in the urine and increasing the risk of developing kidney stones. Citrus fruits are rich in citric acid, which can help prevent kidney stones to some extent, so we can eat them in moderation. In addition, be sure to avoid sitting for long periods and don't hold in your urine. Prolonged sitting and holding in urine increase the risk of urinary tract infections, and urinary tract infections can promote the formation of kidney stones. But most importantly, everyone should remember to drink plenty of water. I'm Hua Xiaolu, and my dream is to become a well-informed, versatile person who never gets kidney stones.